would not be we find it here in the state of Washington. That's what happens with variants. That's what happens with viruses. And over time, as we see people traveling back and forth, there is no doubt that over time we are going to start to see the variants in other parts of the world that we have not seen it previously. We're doing everything we can from a testing standpoint, genotyping and genosequencing. We're one of the top states when it comes to that, certainly working both at our Department of Health lab, and I want to just give a shout out to Dr. Lindquist, his team, as well as our entire Department of Health laboratory staff who continue to come every single day, working long hours to make sure that they continue to do all the everyday laboratory activities, but also the genotyping and other kinds of activities that are related to studying different aspects of this COVID-19 virus. We're also very proud of University of Washington and the researchers that are also doing great work there, and want to thank all of our local partners for the work that they have done to be able to bring people into the fold to work together on this. We had a call earlier this week with local health departments, our tribal nation partners as well, and really had a conversation around how important it was for us to be able to talk about this new variant, and to make sure that we talk about this new variant with a consistency across the state, and that's what we're doing. And so I really just want to give a shout out to all the people that are working together on this. So that's really it for my beginning parts of the message. I will turn it over to Dr. Lindquist, and then after Lacey and Michelle speak, I'll come back for just a quick comment about the importance of vaccines again. But let's turn it over to Dr. Lindquist for some specifics about Omicron, as well as any other information he wants to add from a protection standpoint. Scott?
Yeah, thanks a lot. Thanks for setting it up about Omicron. So the biggest concern we have about any variant is it more infectious? And that is the concern for Omicron. There's around 50 mutations on the surface of this new virus that is not related to Delta. It appears to be an evolution of a virus outside of Delta. And the concern being not so much that it's going to be more deadly. It doesn't appear to be at this point, but it appears to be more infectious. So as Dr. Shah said, I mean, the big question I have about this is how effective are the vaccines going to be? And we don't know that information yet. How effective will the antiviral medicines that are just coming on the market right now going to be? And we don't have that answer yet. And how are monoclonal antibodies going to be against this? So a lot of this, we're all waiting. We're talking weeks before we start getting some of this information. So in the meantime, over a year ago, we set up a very robust genotyping program in Washington State, just for this reason, just so that we could pick up new variants that are coming in from around the globe. And we have not seen this. We have had no detections of this. We have been looking for it since the beginning. We look for all variants, and we will be very clear and transparent when we do see it. We are anticipating that we will see it. We know that travel restrictions have not been effective measures for controlling the spread of variants. We're hoping to slow this down. So we are very much, as a system, prioritizing contact investigation and case investigation around anyone who's traveled from a country that has Omicron or any other variant that becomes of concern. And again, genotyping, there is one inside clue to this virus. There's a thing called an S dropout, where several of the testing methodologies, if it doesn't detect an S protein, that is very consistent with this new Omicron virus. So we are asking any lab in Washington State right now that does this S dropout testing to send us all samples, so we make sure that we're getting a good representation in Washington State. In addition to the sampling, where we do around 10% of all positives in the state, as Dr. Shah said earlier. I mean, we are number 6 in all the states of the US for doing this. So we have a very good chance. Remember, we were the first state to detect COVID. We're likely one of the states that's going to detect Omicron first, if it's not already here. And with that, I turn it back to you, Corey.
Thank you. Next, we'll go to Assistant Secretary Michelle, I believe our order is next we'll go to Deputy Secretary Lacey Fehrenbach. Lacey, go ahead.
Thanks, Corey. Good morning, everyone. Just a few things this morning. Picking up where Dr. Lindquist left off, working with the CDC on a number of issues related to Omicron. As Dr. Lindquist mentioned, this variant has not been detected in the United States yet, though we all acknowledge it's only a matter of time before that happens. And it's very possible it could be here already. We just don't have evidence of that yet. I also want to be clear, we know that it's traveling, that is why travel bans are coming into place across the globe. We also want to be clear, these bans will not stop the spread, they just slow it. So starting Monday, the federal administration announced a prohibition for travelers from South Africa, Botswana, Zimbabwe, Namibia, Lesotho, Eswatini, Mozambique, and Malawi from coming into the United States. We are working with CDC, and we understand that they are going to be working with partners to retrieve contact information for air passengers who have been in those 8 countries in the 14 days prior to their flight to the US, and want to note that there are no specific travel bans related to Washington State, but we will be cooperating with our federal partners on the national policy to ensure isolation and testing as appropriate. Next, I want to talk about WA Notify. The Washington State Department of Health launched WA Notify on November 30th of last year, and we are pleased to celebrate a successful year of this exposure notification application. Since November 30th of 2020, more than 2.62 million people have enabled exposure notification on their phone. That's 43% of all smartphone users in Washington State. With disease transmission still high, it's important that people keep using this tool. And if you haven't enabled it, you can do so. You can either just turn it on if you have an iPhone, or go get it from the Google Play Store if you have an Android device. WA Notify is free, as mentioned, available on iPhone and Android. It's accessible in more than 30 languages. We want to make it as accessible to as many Washingtonians as possible. And a reminder that the system does not track who you are or where you go. It simply exchanges keys, Bluetooth signals that let users know they may have been exposed to COVID-19. No news is good news if you're a WA Notify user. However, if you do get an exposure notification, please get tested and take measures to protect yourself and others. This is another great tool we have and continue to use in our toolbox to slow the spread of COVID-19. Just a few high-level comments on disease trends. Case counts and hospital admissions continue to show slight declines, but both remain at high levels in Washington State. Mortality is still very high, but there's a decreasing trend. We want to note that changes in test-seeking behavior, both prior to and during the holiday weekend, will make interpretation of our data a little challenging over the next week or so. But we're likely to see cases and hospitalizations maybe continue a slow decrease over the coming week. And we are preparing that we might see some increases in cases in the days and weeks ahead following holiday-related gatherings. So want to continue to urge you all to mask up. So far, Washingtonians have been great at masking up through our Delta wave, and we are very grateful for that. We definitely want to keep that trend going, especially as we continue navigating the winter months, holiday gatherings. Delta is still here. It is the predominant circulating variant in Washington State. And potentially Omicron will be here at some point. Given all of this, we need to use all the tools we have in our toolbox. Absolutely, vaccination is number one. Masks, using WA Notify, and getting tested will help us save more lives and keep our disease rates low. Thanks, and back to you, Corey.
Thank you, Deputy Secretary Fehrenbach. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, good morning, and thanks, Corey. As Corey said, I'm Michelle Roberts. I lead the state's COVID-19 vaccine planning and distribution teams. As always, I want to start by giving you an update on our state's vaccination progress. The great news is that nearly 81% of people aged 12 and older have received at least one dose of COVID-19 vaccine, and more than 74% of that age group is fully vaccinated. Across the state, we've given out more than 10.7 million doses of vaccine in less than 12 months. That's really incredible. This time last year, we were still preparing to get the first doses of COVID-19 vaccine in our state. Fast forward to today, more than 5.2 million people are at least partially vaccinated. Let's keep the momentum going and get even more of our friends, families, and community members vaccinated and protected from the worst outcomes of this disease. This includes our kids as young as age 5. Vaccines for kids age 5 to 11 have been available for nearly a month. I'm thrilled to share that more than 129,000 kids across the state have received their first dose of the Pfizer pediatric vaccine. That's more than 19% of this age group. Kids vaccinated at the start of November are already getting their second dose, and over 10,000 kids aged 5 to 11 have already received their second dose. That means that soon they'll be fully vaccinated just in time for family gatherings this winter break. Data has found that the pediatric vaccine to be more than 90% effective in preventing COVID-19 in younger kids. Pediatric vaccine supply is stabilized across the state, and it's no longer a concern like it was a few weeks ago. Vaccine doses are available all across our state. We also encourage all adults who've completed their initial vaccination series to get a booster dose. So any adult can get a booster dose 2 months after their if they receive the Johnson & Johnson vaccine, or 6 months after you received your second dose of either the Moderna or Pfizer vaccine. Over 1 million people have already gotten an additional dose of COVID vaccine in our state. To find locations near you, visit the state's vaccine locator website or vaccines.gov. Type in your zip code, and at the top of the page, you can filter results to show Pfizer.
Did we lose Michelle?
Yeah, it looks like it.
Well, while we're waiting for her to come back, there you go, Michelle, we lost you. Okay.
Okay.
Go ahead. I think we're having what looks like Wi-Fi issues. I think the key message that she was trying to articulate is the information that's on this slide related to going to Vaccine Locator to find both adult as well as pediatric vaccine locations across the state. 833 Vax Help if you need additional help assistance, which includes in multiple languages, and then certainly doing everything you can to really be a champion for vaccines across the state of Washington. I did want to, if for just a moment, just make a comment about why we're making this real emphasis on both primary vaccines, but also boosters. We over time, and Dr. Lindquist can speak to this as well, we get a lot of these questions from people who say, hey, I'm not going to get vaccinated because guess what? I've already had COVID and I don't need to get vaccinated. I think it's really important for us to remember that if you have had COVID, it appears that your protection, the antibody protection that you have, is one, short-lived, but it's also more narrow than if you have vaccine coverage with COVID-19 vaccine, which gives you broader coverage for protection. And so that is an important reason why when we're thinking about variants and thinking about other potential concerns out there, it's a good reason to get vaccinated. If you've already gotten your primary vaccines, we do want to make sure you get your boosters. That's absolutely critical. But there is still a significant portion of our population, even though we're one of the top states when it comes to vaccinations across the country, that still have not even gotten their first dose. And I have said this before, there are many, 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 many millions of people across the globe, if not hundreds of millions or billions of people who would do everything or anything they could to get access to vaccines. And here we have it in our state. It's there. It's free. It's accessible. It's effective. It's safe. And there are still people who have not even gotten their first dose. So please talk to a trusted provider, somebody you trust, a healthcare provider, somebody who a friend who has, good information, not misinformation, and do everything you can to really protect yourself, your kids, your loved ones, and ultimately your community. So I just wanted to make sure to emphasize that message. And I guess that was a good commercial fill-in for Michelle until she came back. So Michelle, back to you.
Well, thanks. I think you covered the really most important points, especially about making sure you're accessing trusted sources of information. And just want to say, we do have a frequently asked questions page on our website that does include a new section about vaccinating youth. So encourage you to go there. And last pitch, while we're talking about the importance of vaccines, as we know this time of year, COVID-19 is not the only illness circulating. It's also the start of flu season as well. So we really encourage everybody 6 months of and older to get flu vaccine. That is really important, especially with the potential of a new variant, to rule out other potential illnesses that are potentially in our community and save our health system capacity for other things. So please get your flu vaccine, and you can get the COVID-19 vaccine on the same day as you get other vaccines, including your influenza vaccine. So thank you, and I'll stop there.
Great. Dr. Lindquist, did you have any quick comment about what I was talking about related to the importance of vaccination, even if somebody has already been, with COVID positive?
I think you covered it well. I think the only thing is we have some evidence, some small studies that show if you were a person who was infected already and then you got vaccinated, they compared that against people who had been infected already, did not get vaccinated, and did you get reinfection? And there was twice the rate of reinfection in those that had not received the vaccine. So I know a lot of people have strong opinions. A lot of people are really hesitant to listen to the science, but I think experience is a very different thing. And so the experience that we're seeing from this is the vaccine adds additional protection above and beyond natural infection. So that's the point. I think you may have been infected by a single variant as we have the emergence of new variants. I think the most optimal strategy is to, if you've been infected, is to get vaccinated to help get additional protection against other variants. It's pretty simple.
Thank you. Well, take it from the doc. So thank you, Dr. Lindquist. Appreciate that. Thanks, Michelle and Lacey. So Corey, we'll turn it back to you.
All right. This brings us to the Q&A portion of today's availability. If we're not able to get to you in time, we do have a number of reporters in the queue. Just know, follow up with us. We'll follow up with you at doh-pio@doh.wa.gov. Give me just a moment to switch over, and we'll begin. Our first question comes from Ariel with the spokesman.
Great, thank you. Good morning. My first question is, does the State Department of Health have a way of seeing how many people who have been infected with COVID have gotten vaccinated or not gotten vaccinated? And then I'm also curious at this point, what percentage of Washington residents haven't been vaccinated or infected? How many people really haven't been touched by some type of immunity? Thank you.
Thanks, Ariel, for that question. I will. I know we have that information. The second question, so Scott, maybe you could pull that up. Michelle, in the meantime, did you want to answer that, or Lacey, if you have access to that first question? I don't know if we have it teased out as much to be able to say who's who's vaccinated, who's also gotten COVID-19, or vice versa. I don't know if we have that information, but I'll turn it to the three of you.
Yeah, and Scott, if you want to, I did pull up the modeling report already, knowing this question was in the queue. So Ariel,
got it right here.
Okay, you've got it too. Great. So Ariel, for your first part of the question, we are not tracking tracking regularly what percentage of people who've had COVID have gotten vaccinated. We hope to do it would be a special data analysis at some point, but right now we're not tracking that. And I know Scott can share kind of what we know about in modeling estimates of population immunity. And I do just want to share that one of the important things to this conversation is to remember that immunity is not even across our state either. And so once we share a little more about where we're at with population immunity, it really does differ by community, which is especially our vaccination rates have kind of a 50-point spread at the county level across our state. So we definitely have pockets where there's much more risk across our state, which is one of the reasons we really continue to encourage vaccination. And I'll let Scott talk about population immunity.
Yeah, Ariel, I think the issue is there's plenty of people that got infected, didn't know they were infected and got vaccinated or didn't get vaccinated. Or there's plenty of people that did a home test, knew they were positive, got vaccinated or not, and did not report that data. So quite frankly, I wouldn't trust this data to be very representative. The best way of getting at this is we've got a very good team of smart modelers that look at all data sources to see who has infection, so what's the prevalence of infection, what's our current rate of vaccination, and then we do a model, and that model shows us that about 34% or a third of the entire state's population is still vulnerable for this infection, meaning that they didn't get vaccinated or they didn't get infected. And that's all based on modeling. It's probably pretty good. So let me say that again. A third of the state's population is vulnerable to infection, and that is just simply unacceptable. Back to you, Corey.
Our next question comes from Steve with Como.
Hi, Corey. Thank you. Two questions for you this morning. I know that there's a lot that we don't know about Omicron yet, but I'm wondering if there's been any sort of discussions about how the emergence of that variant could change the guidelines or restrictions that are currently in place across the state. And then I know that wastewater is being tested in other states to look for early signs of the Omicron variant. And I'm curious, do we know if that's happening here? And would you recommend that cities or municipalities do that?
Thanks, Steve, for the question. The second part of that, I will turn to Scott. I know, obviously, where I was previously in Houston, there was a lot of work that was being done around wastewater testing, and there's work happening here in Washington too. So I'll let Scott answer that. And let me tag team with Lacey on this first part. I would say first, or maybe even Scott has a comment on this. I think the first is that there are a number of both states, but also local jurisdictions who are now looking at their policies or re-looking at their policies. And one of the policies, for example, is masking indoors. And you saw that New York City this week had gone back to masking indoor requirements. And so I think one thing that is really important for us is that we have been doing all the right things from the tools in the toolbox and the policy standpoint already. So, I mean, the good news is that we do not have to reinstitute them to provide additional protection. We do want to make sure that people are following those either restrictions or guidelines or requirements, whatever the case may be. And why that's so important is that when you hear so much about Omicron, and not a time to be panicking, but certainly a time for all of us to be doubling down and be concerned enough that if we decided, hey, we're tired of this virus. Well, the virus is clearly not tired of us, and it is so critical for us to continue to do the things that we know are going to protect us, and that includes the things that individuals can do, getting vaccinated and putting their masks on, et cetera, but also things that we at the state level or with our local partners can do, which is to make sure that people have the appropriate protections in place, not just for themselves, but the safety protocols, so they're also protecting those around them, which I think is so critical. So I think what Omicron has done has reminded us this pandemic is far from over, but what's different from a year ago is that we have an incredible tool. And if we had more people who would be able to take advantage of that tool by getting vaccinated, we would be in even a better place than we are in the state of Washington. And so I would really just recognize that this is just a reminder that the pandemic is not over. The policies I have in place are important to fight this variant or any other variants that may come our way. And certainly, as I said a few press briefings ago, I do not see any information yet that we can pull off of these recommendations because right now or requirements, because right now we're concerned about some of the instability, especially around holidays and travel, which is also an unknown for how that's going to impact our population, our people in the state of Washington. Lacey, anything that I've missed on that? Anything you want to add? And then we'll turn it to Scott to answer the second part about wastewater. Okay.
Okay.
Scott?
Yep, you guys can hear me, right? Okay. So Steve, I'm gonna tell you the same thing that I tell medical students and residents. Do not order a test unless you're gonna do something different with the results. So if it's positive, you do one thing. If it's negative, you do the other. So I would challenge the notion that we're gonna do something different if it's Omicron, because there is not anything that we're gonna do different with Omicron. We know what it takes. You need to isolate if you're a case. You need to identify your contacts so they can quarantine. You need to be able to get testing, and the details of antivirals and monoclonals, that's not going to change. So I'm not a huge fan of wastewater management to change direction for public health practice. I understand the role of surveillance through wastewater to see if it's here. I would rather us assume that Omicron is here already and be much more attentive to isolation and quarantine, getting tested, wearing your mask. And if you can't do those things, then now is the time to get your vaccine. So I don't think or certainly not my response is going to change whether it's Omicron or not. We know what to do. We need to do it now. Back to you, Corey.
Our next question is from Nicole with Cairo Radio.
Good morning. My first question is, do you have any way to say when people get off a plane or something to, when you test people, immediately genotype it so that you can tell if they are carrying the Omicron variant and know that in real time? And is there a way to get that that kind of genotyping to be more widespread, so it's not just a few percentage points of cases that are being genotyped? And then for my second question, I know that there is a little bit of a run on boosters right now. I myself had some trouble getting one, and it seems like, the advice is to take whatever kind you can get first, even if that's not the kind you had before. I had Moderna before and took Pfizer this time. It was the first available. Is there any sort of medical benefit to doing that besides just getting the vaccine sooner? Is it better to mix and match like that? Do you give yourself a greater variety of protection?
Well, first of all, Nicole, thanks for the question. And, if I could add my own vaccine experience, I'm in the same boat as you. Moderna the first 2 times and Pfizer this last booster that I received. So we're in the same category, I guess. What I would say is, back to the traveler question, Scott is absolutely right that we need to be thinking about this as not if this is in the United States, but when it's in the United States. And in fact, as I said very early in the remarks, that it is a good likelihood that it's already in the U.S., especially when you see cases in Canada. And so while the CDC and the federal government are treating those 8 countries differently than the other countries that have also identified cases of Omicron within their borders, I think the key concern is that as we start to see this across the globe, it'll be harder and harder to really figure out, who's going to have what coming from where. And so that's why we really need to be thinking about a two-pronged strategy. One is what's happening with travelers and everything we can do to dampen that or impede that movement of virus potentially within our country, but also what we need to do with potential, given that it's already in the United States. And so as far as testing goes from travelers coming in and being able to then genotype that, I'll turn that over to Scott. I will say that this is really, again, a challenge, because if you're starting to see it in a number of countries that are beyond the initial countries where it was characterized, now it becomes really challenging to be able to test everybody and get those results and get them genotyped. There are a lot of bouncing balls that need to happen. But again, that's really the key focus that we're working with our federal partners on, how best to be able to screen and do things for the travelers that are coming in. So Scott, let's start with you on that one and see if you want to add with that, and then we can go to the mix and match question.
Yeah, again, I think he said it well. I'm not as interested in getting technology to find out what variant you have, because it's not going to change what you do. If you are positive, that is the single most important thing. You need to isolate yourself. You need to identify your contacts so they can be quarantined so this doesn't spread. You need to answer your phone when the public health system calls to do the contact investigation. That is way more important than trying to find someone who can do a genotype. There are some rapid genotype, by the way, that can identify common markers for Omicron that are not done through the full genome sequencing. They are very fast, but they do not confirm the diagnosis of Omicron. You still got to go back and genotype. And so sometimes that takes up to 2 weeks. I just do not feel that that level of technology outside of surveillance is going to help the individual make decisions about protecting themselves or their friends or family.
And just a quick add here, Nicole, for anyone that's traveling from anywhere around the holidays, it is recommended that you get a test 3 to 5 days after you arrive at your destination and 3 to 5 days after you arrive home. And that can be, a home test that you have in your suitcase with you. You can go to a community-based test site, your provider, et cetera, pharmacies. That will help us stop the spread of any of these variants. And as Scott has mentioned, the way we stop the spread and slow the spread is the same, whether it's Delta or Omicron or something else that comes up in the future. So really appreciate, anyone who is going to be traveling for the holidays or work or otherwise to really embrace testing as a layered mitigation measure that helps us keep our communities safe.
And when it comes to mixing matching, really there has been no specific guidance regarding which one to go with. Certainly, the mRNA vaccines seem to have an advantage over the J&J vaccine, and I think part of the reason why the federal government did open up J&J booster for with an additional mRNA vaccine possibility. So I would just say the first and most important thing is to get your booster. The second is to see what is being offered where you are going, and not to, as you said, we know, and it's good. It's a good thing that that people are getting their boosters, and it is making it a little bit harder for people to get them. But it's a good thing that people are getting the boosters. That's markedly better than vaccines sitting on a shelf and not being used, and so that's great. However, don't try to wait for the perfect booster. If you can get somewhere where you get an appointment and they get you a booster, then take the one that is available. I think that's the key message. Corey?
Our next question comes from Jake with King Fund.
Good morning, all. Thanks for the briefing this week. I guess a follow-up question to Scott, what you were just talking about in terms of expanding the testing for Omicron. Is there any thought to expand samples tested at the Shoreline labs? Are you appealing to any other new labs or services that provide COVID testing? And is it worth asking for specific PCR tests to be developed that might be able to better detect Omicron specifically? Thank you.
Yeah, I'll answer that directly. Yeah, so there's a couple things that we talked about this weekend. The public health lab is already instituted. So we have a system where the public health lab is doing genotyping, but we also have contracts with multiple labs around the state, including private or university labs. And so we are continuing to do that, but we also have put out a call to all the labs that do this S dropout testing and saying, hey, look, we want all your positive S dropouts. So yes, we are going to see an increase in volume. We are also turned to the public health system and said, look, anybody who's traveled or has been around a case of Omicron, so like say you were in South Africa and you test positive, we want those results so that we can make sure if we're seeing it in these travelers and where it's there. So there is a bit of upfront increased volume, but once we know it is here, it's going to be very much like we did with Delta. We will watch the surveillance system, which is very representative of Washington State, to see what % of all isolates become Omicron, if at all. It may not be able to compete against the Delta variant. We watched, this is a replay of the story with Delta. We got very excited about Delta. Everyone wanted to know whether they had Delta. And now virtually 100% of all our samples coming through the labs are Delta variant. So I assume if Omicron lives up to how many mutations and where the mutations are, we may see it take on a fair share and compete against the Delta variant here in Washington. That I am very comfortable we have good representative sampling.
And Scott, just I guess in the world of Twitter and social media, it looks like the first confirmed U.S. case of Omicron variant has been detected in California. And that, again, is a report. Obviously, we need to get more information to verify that that's the case. And again, as you see me read that out, and the reaction from our team is what we said earlier: is don't be surprised when you get a positive case somewhere, and don't be surprised if you get a positive case of Omicron variant here in the state of Washington. Again, not a time to panic. It is what it is, and we need to continue to emphasize those tools and strategies. Most importantly, from Jake, your question is also about testing and just making sure that people are getting tested as well. So we'll probably hear more about this, but wanted to make sure that information was out, that we're aware. Corey, back to you.
I want to follow up and note.
And I'm sorry, and that was per CNN. If I didn't mention, that was from CNN that made that report.
Perfect, thank you. Our next question comes from Jessamine with Q13.
Thank you and good morning. Thanks for breaking that news, Doctor. Very, very much appreciated on our end. I'm wondering more about vaccine allocation as we're seeing this run on boosters and both pediatric vaccines. Are we capped out at the top? Are we asking for the most we can possibly ask for when it comes to allocation? And are we anticipating making boosters mandatory with the emergence of these new, more transmissible variants? And then I just have one little housekeeping. I wanted to see the slide that was put up during Michelle's presentation that 117,000 kids had received a shot, but I think she said 129,000. Maybe that was just an updated number. I just wanted to clarify the number of children.
Yeah.
Yeah, I think, first of all, just to say that, wherever we can get more vaccine and however we can get more vaccine, we absolutely are committed to doing that. I think there has been a point where we've had more supply than demand. And so what we've done is been careful that we don't over order or over prescribe a vaccine from from either the federal partners or through the federal systems. So we don't want to also have vaccines sitting there. So I think, one thing that we continue to do is just watch the trends. And when we start to see that there is more demand for vaccine, then certainly our next step is to order additional vaccine. We also anticipate, so this is not just a wait and see, it's also an anticipatory. So what we did very much, as you remember, before Thanksgiving, Michelle made it known that we had made a request to the federal government for additional pediatric vaccine, 5 to 11-year-olds, and the federal government then gave us additional vaccine, I believe 50,000 additional doses over what we were initially allocated. So we're constantly looking at this. And again, when it comes to the importance of supply demand, it is important for us to keep track of that, but also very important for us to continue to emphasize, don't let that be a reason not to go get your booster or have you or your child get your primary vaccines. Michelle?
Yeah, my internet's being a little bit wonky still. Can you guys hear me?
Yes.
Okay, so on our dashboard later today with 129,000 kids initiating vaccine, kids who are between the age of 5 to 11. So it's great to see that we're still getting some significant increases in that data each day. And look, I did that without telling staff, but look, they've caught up to my getting ahead. So 129,000. So thanks for the updated slide. As far as supply, we do have ordering caps from the CDC. We did hit the ordering cap this week for Moderna. So we're looking at that information closely and do always have the possibility of asking for more vaccine from the CDC, as Dr. Shah said. A piece of that is we really need, and we're working with providers to make sure they update their inventory, ordering more vaccines dependent upon current inventory from those providers. And our data right now shows on inventory data that there's about in the state, across the state. So it may not be with the first provider you try, but, and maybe that information could be a little bit outdated from what providers have reported. So that's what we're trying to just get a line and decide, determine if we do need to ask for more Moderna vaccine. So, but there is vaccine supply in the state, plenty.
Michelle, I think we're losing you. Key message is that we continue to monitor the supply and also the demand, and that should not be a reason not to get your booster or your primary vaccine. Corey, we'll turn it back to you.
Got it. And thanks all. With winter weather comes disruptions to our wonderful Wi-Fi and internet telephone infrastructure.
I'm learning that in Washington.
Yeah, we really hope you enjoyed the few months of sun, and it's gone now. So moving on, we'll go to Kate with KUW. Oh, and Michelle, it looks like we have you back. Thank you.
Thank you all so much for taking the time to do this briefing today. I have two questions for you, if you could indulge me with that. You spoke a little bit about travel and testing around travel, but wanting to know if there's anything else you think people need to be thinking about for the holiday season as they're gathering with family and friends. And also just wanted to get a sense from you, Delta really stretched the hospital system here to its limit. There's still high census in hospitals because of delayed care. So what could Omicron mean for the hospital system here if it is in fact more infectious than Delta?
Yeah, thanks, Kate. One thing that we've been emphasizing in at the holidays certainly is to make sure people are getting vaccinated. I know it sounds like a broken record, but that is so key to gathering around people. You want to make sure people that are coming into your home are vaccinated, and certainly you want to make sure if they're not, that they're wearing masks and or they're staying distance, and certainly testing is an important consideration as well. So we want to make sure that people are, especially if they're not vaccinated, coming into your home, that you do want to, and being gathered for not just like 5 seconds, but really there for a significant amount of time, that they're also, you have some knowledge about whether they're COVID positive and just don't know because they don't have any symptoms. So there are a number of things there. In terms of travel, I do think we need to emphasize in this time of new variants that are, getting the attention of people, that you should really be thinking about where you're traveling to. And so if you are going into a country, for example, where there are travel restrictions or prohibitions, that you may be asked to do more things. You may have to extend your travel. You may be asked to do things when you come back into the United States. You may be asked to get tested. You may be asked to show vaccination records. There's so many things that may occur. So you really want to know what's happening in both the destination, but also where you're going, to be able to make sure that you know what's happening within that geography, if you will. And then the other thing is that because, over time, we are going to see more cases, additional cases of this variant, but also the Delta surge across the country here in the United States. You do want to be very mindful of what's happening in the community that you go to. And if you are going into a community or a state where there is a surge, or there's a concern for additional potential for transmission, we do recommend that you consider what steps you're going to take to protect yourself, and whether you should even travel. So there are a couple things that we're asking people to do as well. And then certainly the messages that we've given about being safe as you're in transit, especially in airplanes or, along the way, getting into and out of the airport, or even on other kinds of transit, for example, if it's mass transit, et cetera, just thinking about what things you need to do to protect yourselves. So I hope that helps. As far as Delta and Omicron, I think it's too early to tell, as you can imagine. We absolutely know that our healthcare system is stretched, and that stretching is going to continue to not just be more accentuated by a new variant, but it's going to be because this is winter season, as Corey just reminded us, and people are going to be indoors more. There's potential for respiratory viruses, especially flu and other RSV, et cetera, type of viruses. So it's just really incumbent on all of us to take the protective steps that we are told every single year to do, and simply a lot of times we don't do them. And so I think it's important for us to be taking those protections and precautions. It is too early to tell about Omicron, I'll be honest. I don't even know if we have enough information to really make a cogent statement on how it could impact our healthcare system, since we have so little that we know about it right now. Scott, anything to add, or does that pretty much cover any?
No, I think you covered it.
Okay. Corey?
Our next question comes from Sally with the South Seattle Emerald.
Hello, thank you for taking my question, which is very technical. You issued a new report on the COVID cases by industry, and the pages weren't numbered as I looked at them, but just counting, it's page 6 I'm talking about, which is industry sector by race, and it's a table, and I just wanted someone on the staff to comment on, in the industry sector of healthcare, 35% of cases are in people who identify as non-Hispanic Black, and that population, it only represents 21% of the population. So I wondered if you could just explain that, how that could come to be, and potentially what the reason would be.
Thanks, Sally. Sorry, I was on mute. thanks for that question. And Scott or Lacey may have any additional details on this, but I would say, first of all, you're correct that in the healthcare industry, it does look like there is a disparity in the African American population. There's also appears to be maybe not as much so, but a disparity also in the Asian American population as well. And so I think we have to, one, continue to monitor this and as trends and not points in time. But number two is, as you know, we have been fighting the scourge of health inequities throughout this pandemic, and this pandemic has really just accentuated the focus on it. It doesn't mean that it started, but it certainly has made things worse. And so when we look at, for example, healthcare industry, it's really everything from making sure people are, have the right messages and getting vaccinated and doing all the things that they can do. We are, obviously concerned about systemic issues that may be in play when it comes to, historical trauma or things of that nature, or lack of confidence in some of the protective measures, including vaccines, but not limited to vaccines. So I think there are a number of different reasons that in general, we need to continue to emphasize working with, for example, our African American community members. We're doing a tremendous amount of work in the community with champions within various communities, including work with our faith partners, as well as making sure that those very trusted messengers and those who are very much concerned about health inequities in their very community are working with us and working with our local health partners as well in this. So there's a lot of work ahead, but thanks for highlighting that. I don't know if Scott or Lacey, you want to add anything that I may have missed, but just in general to say that health inequities are no, just because you're in the healthcare industry does not make you immune to being subject to a health inequity. And that's the real concern about an inequity, is that it can persist despite having all the tools available within that very system. So Scott or Lacey?
Yeah, no, I think you covered it well. I mean, it's your cat is the data is missing a large portion of actual data. I think in some of these, it's up to 40% of the data is missing on race and ethnicity. So I urge us to look at this with some caution. We are trying to identify inequities, but again, data collection has been a big limitation to this. Some people don't want to give that information, but that's why we look for it, and that's why there tends to be some holes in the data also.
Just a quick note, I think we report this data by race, ethnicity, and we see the gaps by race. And just, to be clear, and Dr. Shaw alluded to this, it's very complex. People have different types of exposures depending on their types of role in whatever the sector is. But we do know that people of color are more likely to be frontline workers. And that brings risk. And then also just to say explicitly, that when we see these differences, it is driven by systemic and structural racism, not by race, and really want to call that out and name it. And we issue these reports so we can figure out where we focus those community-based efforts and our efforts with, partners like the healthcare system. And we all have tremendous work to do in this regard.
Thanks, Lacey and Scott. Lacey, well said. Really appreciate that. Okay, Corey, and how are we on queue? I don't know how many reporters we have left. I know we're a few minutes over here.
We're a few minutes over. We have 2 reporters left in the queue.
All right, let's finish out so we can get to everybody.
All right. Our next question comes from Graham with Cairo.
Good morning. Thanks for doing this. Dr. Shah, you're highlighting the importance of boosters, and yet some people around Seattle are really struggling to find booster appointments. We're hearing health systems are stretched with staffing challenges and are prioritizing pediatric vaccines. Are you tracking appointment availability, and is it time to bring back mass vaccination sites?
Yeah, Graham, thanks for that. Let me turn that question to Michelle in terms of tracking the appointments. I will say that, again, we continue to do everything we can to support our healthcare and public health partners on the ground, and then certainly where we need to work with our federal partners to get, whether it's more vaccine or, as you know, during the healthcare concern of the Delta surge, we certainly even asked our federal partners for additional personnel resources. So we're willing to do what is necessary to support our system and ultimately people in our communities. Michelle, I don't know if you are tracking appointment availability. If you could comment on that, or are you still on?
Yep, I think
Okay.
I'm here.
Okay, there you are.
At
Okay.
least for a moment. Let's go quickly. We are not tracking appointment availability at the state level. Most of the information is in the different provider systems. What I can say is we're hearing reports in King County too, working very closely with Public Health Seattle King County to support access and address what's going on, making sure we have accurate inventory information from providers, like I mentioned. And we already are supporting King County and partnering with them on mobile clinics in the county, especially in South King County, to help with access. And we're going to continue to do that to make sure we can address any gaps as they continue to develop, and look at if we can get additional vaccine into the state too, if that's what's needed. So more to come, and we're actively working on it.
Yeah, the other thing I do want to emphasize that one, there's news about Omicron variant, but there's also been confusion on who was eligible for boosters. And we're hoping that that is going to start to even things out, that, you know, when you get important information about a new variant, and then you have an announcement from the CDC that says that everybody 18 and above should get a booster if they're, you know, over that time frame of being eligible. Now all of a sudden everybody says, well, I've got to go make the appointment. And again, we have to remind people that this is if you've already had your primary vaccination, that it is not somebody starting from zero when you have your first vaccine. This is protection that you already have. Over time, it starts like a dial. It starts to come down, but it does not mean that you do not have protection. So we do not want people to be overly concerned. You just be patient, and you'll be able to get those booster vaccine appointments. And as we continue to monitor that, if we need to do and take additional steps, we will certainly do that. But again, we want to make sure that that trend is not just an artifact of just an announcement or concern, or for whatever else is in the news. The other thing, and the reminder that we have, is that if you have multiple appointments that you have scheduled, please cancel the appointments when you get your vaccine at one location, so you do not hold the line, if you will, in multiple places, so others cannot access appointments. So, Corey.
All right. Our final question will be read by me. So here we go. Pull it up here. All right. This one's for Dr. Shah, but feel free to jump in. Do we have any idea when boosters will be available for 12 and up?
Well, thank you. And thank you, Miravina on Twitter, for asking this question. So we do try to monitor what's happening on social media in real time. That's a great question, and I am actually going to be very smart about answering it by turning that one over to Michelle. I think Michelle is going to be able to provide the best answer for that. But I think this is an important question for parents, and the question really is very much at the heart of how do we continue to protect our kids when they may have gone beyond a certain time frame since their last primary vaccine as well. So Michelle, turn it to you.
Well, great. We don't have that answer yet, but is one of the things that's being investigated in real time right now. So we know that Pfizer has enough information on 16 and 17-year-olds, and they did just this week submit a request to the FDA hold on. I've got an automatic restart message. I hope I can hold that one off for a moment. But so Pfizer's asked FDA for booster doses for 16 and 17-year-olds. So we'll know more information about that soon. And data is still being collected on kind of 12 through 15-year-olds. The good news is Pfizer did release some information when they had 4 months of data, and the vaccine was still showing 100% efficacy in those age groups. So that's really incredible after 4 months. So a lot more to come. The other thing I'll say about our youngest kids, 5 and up, and those adolescents, is that their immune systems are at their peak, and they do, for all vaccines, there's lots of great data over time that they have the highest response to any type of vaccine that leaves them incredibly well protected anytime they're vaccinated. So more to come on this story, but I think we'll have a better answer on 12 through 15-year-olds in a few months.
Thank you, Michelle. Corey, was that the end of questions?
That's that. Back to you, Dr. Shah.
Well, I just want to thank everybody for joining us. We know that we went a little bit longer, but hopefully we were detailed enough and provided as much information as we could. I want to thank Dr. Lindquist, Lacey, and Michelle for joining this morning, as well as Corey Yu and all of our Department of Health communications teams for all the work that you do every single day to help us with this briefing. I want to just close by saying that there is a lot that we still don't know about Omicron, but what we do know is that vaccines and other tools are incredibly effective against the variants that we know are already in our state. And right now that includes the Delta variant. And so if you have not gotten your primary vaccine, or if you are eligible for a booster vaccine, we would strongly encourage you to get your vaccine today. Do not wait. And when it comes to appointments that are filling up and appointments that are harder to get, we will continue to monitor that. And if it turns out that we need to take additional steps, we will certainly prepare to do that. We will do everything we can to support our community members in getting vaccination as well. And then finally, the message is that there are a lot of really moving pieces related to travel and holidays. You want to make sure people continue to emphasize not just getting vaccinated, but also from avoiding large gatherings and making sure that if you're traveling, you're taking appropriate steps. And then certainly the importance of testing. That is such a key message for all of us. So with that, thank you so much for joining us this morning, and we hope you are well and safe. And with that, Corey, I'll turn it to you.
This concludes today's media availability. I'd like to thank our panelists for making time and for all of you for joining, and a special thanks to TVW for hosting this briefing as well as others in their archive. Take care.